would like to welcome Dr. Kayden.
Thank you very much. It's a pleasure to be here. Thanks for having me, and thanks for such a great turnout. It's a busy work day, and I know everyone needs to get back into clinic or teaching, so we will try to stay on time. So I'm going to tell you today about a simulation training program that we do at Harvard in order to train both doctors and other kinds of aid workers from around the world in humanitarian response. Now, you may ask, why is an emergency physician involved in doing this? Well, just very briefly, in emergency medicine, we have a subspecialty that not everyone in the House of Medicine knows about yet. It's international emergency medicine, and in that specialty, we do two things. On the one hand, we help to improve the day-to-day emergency care around the world. So we work with ministries of health and hospital systems and universities. That's not what we're talking about today. On the other hand, we do this. We do international disaster response, humanitarian relief. That's a lot of refugee camps, war medicine, and a lot of this disaster response, which is what you're going to see today. And at Harvard, we have something called the Humanitarian Academy at Harvard, which is a place where we train both for-credit classes and students who are enrolled in degree programs and professional education seekers who come from the field or who come from other specialties like medicine to come and do this kind of training. So part of my job is I'm the director of the Levine Family Humanitarian Studies Initiative, which is the professional education arm of the Humanitarian Academy at Harvard. And so in a few minutes, I'm going to tell you about a massive open-air theater, 3 days and nights, field simulation with 250 people in the woods of North Andover, where we do this. This is simulation like you've probably never seen it in medicine before. But the goals of our simulation program are going to be similar to a lot of the goals of simulation that you are used to in medicine. We focus a lot on teamwork, and the real point of what we do, which I'll explain to you later, is we want people to be able to feel what it feels like to be in the midst of an acute disaster overseas in an unfamiliar situation with all the same stressors, so that they can know how well they can implement the skills they learn in our classes in the field. The time to learn that is before you get into your first humanitarian crisis. Having been in the field, I can tell you that we sometimes have to ship people home. People lose it. They break down. And it's extremely costly, it's extremely disruptive, and it takes enormous resources to actually evacuate someone from the field. So the time to learn whether this is the job for you is with us here in the woods of Massachusetts, and not when you get into the field. So, one disclaimer I will say, this field simulation has been taught for about 15 years now, and every year we make it more and more complex, and every year we add things. And for those of you who think you may want to engage in this training with us someday, you'll know that after the first video that I show. If at that point you think you want to do this, please step out of the room, because the rest of the videos are going to tell too much about it. I would also ask that those of you who are interested in this, please don't Facebook and tweet about the details of the program, because, again, we need to keep those confidential. It's a little bit too complex to rewrite every year. All right, so why do we do this? The first thing to know is that disasters are on the rise. This is some information from the Center for Research on the Epidemiology of Disasters in Belgium. And this just shows natural disasters, doesn't even include the conflict-related disasters. And this particular slide goes from 1900, which is on the left, all the way over to 2002. And what you can see is that natural disasters, this is the red line, the absolute number is on the upswing. That trend has continued to today. And as we have more disasters, now that these natural disasters are mainly weather-related events, that's what accounts for the upswing. So whether you feel that global warming is real or not, what we in the humanitarian business can tell you is it's causing, in fact, more and more disasters that are affecting more and more people. Conflict-related events are also on the rise in the amount of refugees that they produce worldwide. Think of the Syrian refugee crisis. That's just getting worse and worse. So we need more and more humanitarian responders. Now, why are we training humanitarian responders? Most of the people who do this work in the world have no formal training. Most of the people who do this work have no formal training. It's not like being a doctor or a lawyer where you go to school and you get a degree in humanitarian aid and you go out and you become a humanitarian aid worker. That is now becoming possible as the field professionalizes, but it's really hard to approach. The other thing to know, especially for us doctors, is that most of what saves lives are public health interventions, not medical interventions. It's hard for doctors to even get to a disaster site within the first 72 hours. Once they arrive, most of the people they could have helped are either dead or alive, regardless of their efforts. And unless we're talking about an earthquake, which produces high levels of orthopedic, neurologic, surgical disease, most of these foreign medical teams are actually not necessary. So if you're going to be a doctor and do this, you need public health training. The major causes of death for these displaced populations, people who have been forced from their homes for disaster, are usually due to diarrheal disease, acute respiratory infections, malnutrition, malaria, and measles. And those of you in the room will know that to prevent these are public health measures. It's water and sanitation. Okay, so even when you go as a doctor, you need different kinds of training. So more professionalization of the aid workers is definitely needed in this field. That's why we have the Humanitarian Academy at Harvard. We are trying to promote that professionalization, and this training program is part of it. Medical training alone is insufficient for humanitarian response. It is insufficient. In the 2010 earthquake in Haiti, people who are professional humanitarian workers say that there were two disasters. The first was the earthquake, and the second was the response. Haiti, fortunately and unfortunately, happened within easy plane flights of the United States, where many very well-resourced doctors, very well-meaning doctors, could fly in. And we saw people come in who had never done this work before. They'd been on medical mission trips, not the same thing. They had sometimes worked overseas in different capacities. That is, those skills that one knows from those experiences are not the same skills that you need. You don't know about the coordination systems, the international humanitarian architecture, how this is all set up, and what are the guidelines and standards that you need to meet as a doctor who's going to engage in this. So we saw people doing medically inappropriate things. We saw a lot of people practicing on the local population, a lot of medical students, residents who weren't quite trained, doing things that would never have happened in the United States and are certainly not to an international standard, even in an emergency, all right? Good intentions are not enough. This is not charity work. This is the fulfillment of rights that people have who are caught up in these crises by international law. And if you don't know what the rights are and don't know what the standards are, you can't fulfill that mandate. The problem, though, is that field experience can be really hard to get. There are many ways in which an acute crisis is not the right place to bring trainees. There simply aren't enough resources. So, for example, in Haiti, even if you showed up, a lot of people showed up, they had nowhere to stay, didn't think about that. There were no hotels, and what few hotel rooms were still standing and inhabitable had long since been snapped up by CNN and the BBC. They're always there before you guys, okay? There's nowhere to stay, there's no food to eat, all right? In that case, the ports were broken, which means that markets weren't quite working early on, and what food there was needed by the local population. There wasn't a lot of clean water around. Even if you could get a vehicle in, which not many people had vehicles, there was no ready fuel supply to drive around in. No one to drive you around. Why? Because the earthquake breaks the underground fuel lines that connect the tanks underneath a gas station up to the pumps. So dirt and soil gets in. You can put that fuel into your truck just one time before it clogs your engine. And so there was this mass of responders, all right, who weren't being really productive. And a lot of times we're doing the wrong things. So when you go into one of these situations, the actual resources we have to train people are very, very few. You may only have one truck in the early days, even in a major aid agency, to do your initial rapid assessments that have to be done in the first few days. And there just isn't an extra seat for a trainee or for some kind of non-producer. The teams are small. The forward teams are about 6 people. There's a team leader, and then specialists in things like water sanitation, health, including often a doctor, shelter specialists, child protection specialists, and people like that. It's a very small, intense group. So you can't just send people who want to learn about this as we do on apprenticeships into the field. We send our interns into the hospital, they buddy up with us, and we teach them what they need to know. See one, do one, teach one. That's not really how this works. It's not how it can work. And that's why these field simulations are really, really critical. All right, so what do humanitarian responders do? I've told you a little bit about it. From the medical perspective, it's really focused on public health, or if we are doing medicine, we are usually restoring primary healthcare services. But the first thing you want to do immediately after a disaster is conduct a rapid assessment in the field. What are the needs? What are the priorities? What needs to come in first? That we do because we don't want to waste resources. There already is not enough around to go around in the field. We use global standards. We use the SPHERE standards, is what it's called, the SPHERE project, to produce response proposals. So we have to write funding proposals in the field. All of that happens within the first week, even in the largest of disasters. So there's a lot of driving around, a lot of time pressure, and a lot of writing down. We deliver aid, of course, and then we have to monitor and evaluate programs. That's the basic step. Now, what do humanitarian responders these days endure while they're doing that? Well, time pressure is a huge, huge part of this work, especially in the acute phase. There is a lot of physical discomfort. All right, again, there's not good housing and you don't have ready access to showers. When we responded to Haiti, my colleague and I who set up the field hospital, we didn't shower for 3.5 weeks. We were pretty ripe. It was uncomfortable. All right, thank God for baby wipes, but I mean, this is not something you do on a normal day. There's a lot of emotional stress. Of course, it's difficult to see what you're seeing and live what you're living along with the people who've been affected. But there's also a lot of cross-cultural stress, even between the people on your own team. A lot of these international humanitarian response teams are made up of, one guy from France and one guy from Germany and one guy from Italy and an American. And boy, that just good teamwork right there. They all come from different disciplines. They all have a different worldview and perspective. And yet they have to work together as a team to do this, or thousands of people don't get helped. And unfortunately today there's a lot of insecurity and violence. We'll talk about that a little later in the presentation. But the #1 killer of aid workers in the past was motor vehicle accidents. Since about the time of the Iraq War, it's directed violence. And we'll see some numbers. So teamwork, resilience are absolutely critical to this work. So what is our course? Ours is called the Humanitarian Response Intensive course, and it's 2 weeks. We do 9 days in the classroom, and these are some of the topics that we teach, most of the topics that we teach. We break the students up into 8 agency teams. Over those 9 days, they work in the classroom, they get interactive lectures, and then every afternoon we do tabletop simulations of all the different sectors, water and shelter and healthcare and food, all right? And we teach them a lot of the field skills they need, media skills. We teach them landmine awareness, how to keep your aid agency safe in the field. And then at the end of those 9 days, they stand up as groups, having coordinated with the other teams, and present fully budgeted aid proposals for the tabletop simulation group of refugees that we presented them with, all right? So they've basically, all the tasks we want them to do in the simulation, they've done it already, tabletop. Then we do 3 days of field simulation, and it's a totally different thing. Like I said, we have about 250 people engaged in this. About, depending on the year, between 100 and 120 of those are students. They take on the role of aid workers. They're broken into aid agency teams, and this is like Doctors Without Borders and Oxfam and Save the Children. Each of the teams is mentored by what we call a country director, which echoes in real life. There is usually a Doctors Without Borders country director, and you would report up to them as you were doing this kind of work. And so those country directors and a lot of the people in the simulation are faculty who come from the aid world, or they're humanitarian doctors. Some of them are our former students even, who have experience in the field so that they can help create a realistic scenario. We have media injects. So the gentleman in the bottom left is Ian Cartwright. He's a BBC cameraman. And a special thanks to Ian because he's responsible for all the videos you see today. He does them for us right in the field, clips them, and finalizes them right there. And we have news broadcasts on Saturday night that he can do. He's amazing. So they're out there, so they go in, and what the students are told they're going to do is they're going to be rearranged into new aid agency teams with people they've never worked with before. They land on a Friday morning. They go in through customs and passport control and all the usual things. They have to set up their NGO compound, which is the campground. And then they're told that they have to do what they would normally do. Rapid assessments, okay? Make your plan, reassess as the situation changes, and by Sunday at about noontime, they have to give us a fully budgeted, coordinated proposal to help the refugee community in this area, about 100,000 people, to give them the aid they need for 1 year. And they're going to present that to USAID and all the usual governmental funders, right? That's their task. And they think, no problem. I've done that before. We did it in class. We're ready. Bring it. Let's do it. You know, they're very, very cocky when they get there. Now, so they think they know what they're doing. The scenario that I'm going to show you is based on, we have two fictional countries called Warani and Agunda. And so the simulation that happens over 3 days is there's been a cross-border sort of skirmish. There's a lot of conflict in this area, as there often is even in natural disasters when we go. Conflict is a big part of our work. And there have been people who, after a recent windstorm like a hurricane, have come across the border because their crops are failing. So there's a lot of refugees coming into the country of Warani, and those are the groups they have to find, assess, and help, right? A lot of other stuff that's going on in there. So I'm going to show you first a video that's about almost 3 minutes long that kind of sums it up. And then we'll go through the various teaching points one by one. I'll show you some more videos. Again, if after this video you think you want to take this course, you really should leave because you'll ruin the surprise. All right, can we please have the video quick? What the humanitarian field needs is more professionalism. There are over 200,000 humanitarian workers in the field this year. And of those, only a small number have been professionally trained. And yet they're responsible for millions of lives around the world. So with this course, what we hope to do is bring more professionalism to the aid agency community.
Where's the rest of our team?
On the first morning of the sim, the students arrive at the border of the country of Warani. They have to go through passport control and customs just like you would in any country.
How long will you be here? I'll be here for 3 days.
The students have to go to the refugee camps that we set up. They have to find out how many refugees are in this camp and figure out what problems they might have there.
The estimated population people are here in your area?
Yes, I say there are 15,000 people here.
15,000 people here.
We put a strong emphasis in the simulation on creating a realistic, stressed, uncomfortable scenario for the students. Because it's one thing for them to be able to do this work on paper, in the classroom, but it's something quite different to be able to perform at your best, to meet international standards, and to do a professional job when you're stressed, tired, hungry, cold, and running out of time.
We personally will develop 28 child-friendly safe spaces.
At the end of the simulation, the students have to produce a fully budgeted plan for the aid for this community for an entire year. If they don't do a good job creating a realistic, workable plan in the field, they don't get funded and their NGO has to go home. And as we say in the business, no money, no mission. As this year's simulation is wrapped up, what I'm hoping the students take home is a good sense of how they might contribute to the humanitarian community and a sense of how life will be for them as a humanitarian worker in the field.
The simulation itself was the greatest exercise in having the open space to learn process and not product, and to apply all these things and really get out there, do it, make the mistakes, figure out what you need to learn more about, figure out how to work better with your team. It really was just a learning experience. I hadn't had anything like this before.
So some of you recognize Michelle Nisharenko, who is now the head of all global health at Boston Children's Hospital and is one of the most capable people you will ever meet in your life. She had a big role to play actually in the Ebola response in Liberia. She's one of the main players in Liberia, so a proud former trainee of mine. So what you saw in the video were a lot of students. Now, about half of the students you saw are graduate students that come from Harvard, Tufts, and MIT. They're studying a lot of different things. Public health, of course, from Harvard, but we also have humanitarian logistics students from MIT who study humanitarian supply chain management. From Tufts, we have humanitarian nutritionists, law and diplomacy students. There are some people taking a humanitarian aid degree from Tufts. And also from Harvard, we have a lot of people from the Kennedy School, the School of Education. In fact, I've taught people from every school at Harvard, Divinity School, Law School. They've all come through. So it's an extremely mixed group. We have a couple of undergraduates who join us. The other half of the students are the ones, so the graduate students are taking a semester-long course and then they join the simulation. The other half of the students are taking this 2-week course, and most of our students nowadays are from aid development organizations around the world. So they come from the United Nations and Doctors Without Borders and Oxfam and Save the Children, and they want to be moving from development into the humanitarian response work. You saw some military people in there. We actually train the U.S. Army and Navy civil affairs brigades. They join us for their training so that their guys will know really how to interact with the civilian space, because the military and the civilians are very different. It's good for our students and it works for them. There are a couple more training resources if you want to learn more about this. Our course is again called the Humanitarian Response Intensive Course. It's open, it's a 2-week course, open to anyone who wants to take it. You can sign up at the humanitarianacademy.harvard.edu. And then there are a couple of online things. The SPHERE project are the international standards. The Building a Better Response is an 8.5-hour online training program that some of us at Harvard, together with a couple of NGOs and USAID, made for the international aid community that explains how the aid world is set up and how it's all structured and how we all work together. And then humanitarianresponse.info is another place that you can go to find out a little more about how the international humanitarian community organizes itself.